I think it's really important. It's brilliant to be recognised, or the work that we've done has been recognised in hair loss support for cancer patients, and it's something that we would like to see rolled out nationally, so the same sort of cancer centres all over the country having similar support services for patients. So I think it's wonderful to be recognised and to be able to tell other people and share the good practice.
Okay, so you received your award last year. What changes, what developments have you seen in your work since then?
The recognition has made a huge difference. We've had contacts from different sort of cancer organisations and hospitals throughout the country, and they're coming to visit our services, which we've arranged so that we can share and show people what it is that we do, which is really valuable. And also we want to go on with the work that we've done to different sort of groups that are maybe not getting as good a service, and making sure that it's equitable across the board.
I think receiving the award as well has given us the confidence in what we do as well. So it's been really nice for this part of the service that can traditionally be considered quite a fluffy service to have been raised in the profile of what we do. And as I said, it's enabled us to champion our work right across the hospital with confidence.
I'd just like to say I'm here with my colleagues Tom Mansell, the Macmillan Information Support Project Officer, and Marie Nebard, Macmillan Hair Loss Support Worker. Hair loss support is of massive importance to patients, yet is often overlooked in the provision of cancer services nationally. Hair loss support is a vital component of quality cancer care which seeks to promote emotional and psychological well-being. We're in a very fortunate position at Leeds Teaching Hospitals to have 2 substantive post holders providing hair loss support, which has enabled us to offer this care for some years. The team at the Robert Ogden Macmillan Centre have now been able to build upon this to address important issues of equity and access, and also to look at alternative models of providing care to maximise patient satisfaction. As far as we are aware, there are no other hair loss support workers employed in cancer services nationally, and certainly feedback from the National Cancer Action Team has suggested that we are unique. The Robert Ogden Macmillan Centre has provided hair loss support services since 2001. The team has developed this service over the past decade and recently won the Improving the Quality of Life for People with Cancer category, and were highly commended in the Reducing Cancer Inequality Initiative at the 2012 Quality and Care Excellence in Oncology Awards. The service started with 1 support worker working 15 hours a week. We now have 2 support workers providing 42 hours a week of hair loss support. Julie Carrick and Marie Nebard, pictured, are wig fitters and hairdressers with many years' experience in providing practical and emotional support for people coping with hair loss due to cancer treatments. The services include hair loss advice and support, hair cutting before and during treatment, assistance with wig selection, the wig fitting, cutting, styling to specifically suit the individual, wig care advice, and support through the hair regrowth after treatment, including first cuts and advice on colouring. The service also includes alternative headwear, hats and scarves, with volunteers trained to show different ways of tying headwear. In 2011 to 2012, the service ran 1,254 appointments, with a further 503 people getting information and advice over the phone. The team sought to improve the service through a variety of initiatives, from improving the equity of hair loss support, improving acceptability with a wider range of patients, addressing cultural and ethnic needs, to better access to the different models of service provision. I'm going to hand you over to Tom Mansell to talk about the initiatives that addressed improving the equity of the services. Tom.
Thank you, Sadie. So we know from feedback and data and from the service users coming through our doors that people from BME communities or black and minority ethnic communities, they're not frequently accessing our support services, and I think that's reflected nationally. So what we want to do is see what actual changes we can make on the ground to make the services a bit more culturally sensitive. So alongside work in mosques, going out, taking our services into the community and promoting them, I supported a community organisation called the BHI, or Black Health Initiative, to deliver what's called Macmillan's Health and Wellbeing Clinic project. The clinics are actually being run nationally, but what we designed was what we call a culturally appropriate clinic to engage the Black African Caribbean community and support patients during and after cancer treatment. And when I say culturally sensitive, what we mean is that we created an informal environment. You can see the chap there, Ansel, actually introducing the clinic with a playlet. We had some gospel singers and we had food that was appropriate. So what this meant that by taking the services into the community, rather than us as health professionals going and talking directly to people, we encouraged a feedback where patients felt confident enough to stand up and give us that feedback. So the topics that we covered included the emotional effects of cancer. We invited people to talk about topics such as body image and cancers that were prevalent in the community. So when we were talking about body image, one of the key issues was of course hair loss. And we invited a local hairdresser to speak alongside our own hair loss support worker, Marie, to talk about a hair loss support worker. Now, we know that within the Black Caribbean community, wigs and weaves are commonly worn anyway. So naturally, the service users were very passionate and were likely to have a bit more of an expert knowledge about wigs. We identified from the service users at the clinics that I think they were a bit concerned really that the wig selection on offer might not be appropriate. And they felt that, and very logically, they felt unhappy that the catalogue that we used only actually featured white models. So alongside this very passionate feedback from the clinics, we received a patient experience report, and there was a key quote that I'm going to read out to you, highlighting the need for change with our hair loss support workers. So from the patient experience survey, a patient fed back that hair prosthesis on the NHS is inadequate. Inappropriate yet expensive wigs are supplied. And of course, the patient went on to say, Leeds is a diverse community, and it should not be difficult to find cheaper, more appropriate wig supplies for black women. And the NHS needs to urgently address the more culturally appropriate service. Based upon this feedback from the patient experience survey and the feedback from the clinics, we decided to hold a focus group at the BHI, so that organisation actually taking the service into the community to discuss it with our service users. You can see on the slide there, we showed some of the wigs on offer, but actually in appropriate colours. And I think, to be honest, the patients and the service users were actually very surprised about the selection of the wigs we had. The feedback on the wigs was very, very positive, and it was agreed that actually the issue was not with the wigs, but it was the way in which we were presenting the wigs. The women also fed back that they wanted to feel confident, alongside the fact that we had the appropriate selection of wigs, that we had the right specialist knowledge. So some training was arranged with a specialist wig consultant. Maria, our hair loss support worker, is just going to give you a quick example of some of the learning she learned from the specialist.
Right, I wanted to know about the different chemicals, such as the relaxants that are often used to straighten the hair for Black and African Caribbean people. Also, the different oils that are often applied to their scalp. By increasing my knowledge about the most commonly used products, I was able to offer advice on what to do and what not to do. For example, I would advise a Caucasian patient to purely use olive oil to the scalp where there is a dryness of the skin caused by the chemotherapy treatment. But for the Black African Caribbean hair, pure cocoa butter with aloe vera is commonly used.
So alongside actually inviting Marie to increase her knowledge around Black African hair needs, we worked with the wig supplier to actually increase the range of wigs that we had available, of course within the limited budget. And this was actually an opportunity for us to create a bespoke electronic catalogue. So that meant that patients could be shown the wigs in information lounges or even have a look at the wigs available from the comfort of their own homes. We actually invited some of the models that you can see there to be part of our catalogue. The wig that we've got on display here, I think it's known as the Victoria, is a very commonly used wig fitted on a Caucasian model. So that's one of the photos actually from the existing catalogue. When we put the same wig onto one of our models from the group, you can see it looks completely different. This meant that people could find somebody in the catalogue that they could identify with, and we hope that this would increase the confidence in the service. Again, I think the next slide shows this is what's called an angle cut, I've learnt. And again, if we show the slide on one of our own service users, this is exactly the same wig, but personalised and shown on one of the models from the community.
Right, I fitted this lady with an angle cut, and I was able to personalise it by cutting the wig for her. She then applied oils to the wig, which she naturally did to her own hair, so that it was more personalised to what she wanted. When this lady's hair came back, she had no pigmentation on the front of the hair, meaning this was white. She had decided to colour it herself without taking any advice, and she hadn't realised that the chemicals would still be in her body a month post-treatment. She tried to dye it black and it turned purple. Unfortunately, there was nothing that I could do, so she continued to wear her wig. I do advise all ladies, all the patients and the guys that I do see, to see if they can wait at least 6 months before dyeing their hair. And before they do so, to do a strand test of the hair and also a skin test so that we don't have any complications after.
So I think one of our key success rates really was having community members and actually our patients involved in the design of the service. I think particularly with close-knit communities, BME communities, word of mouth is key. People in barbershops and churches, they will talk, and I think we all know that bad news and bad reputation spreads a lot faster than good news. So we hope, as I said, we hoped that these ladies, because they've been involved, they're in the catalogue, they're part of the community, that they would act as champions for the service. And I think really we're very proud of the fact that we've had the patients involved, and I think that's been one of our key successes in actually increasing the number of BME service users in the supportive care service. We do collect data, and we have seen an increase in the number of service users, and that's actually had a knock on to the rest of our service as well. So it's not only our hair loss support service, but our complementary therapies, our information, and our psychosocial support services. We've also seen an increase in number of users. And again, another positive comment, when we think back to the patient experience survey, when we had a negative comment, one of the service users was actually interviewed for a local newspaper, and I'm just going to finish off by giving the quote. And she finished by saying that the service is brilliant. They had a really good supply of wigs, and they also had a lot of knowledge about Afro-Caribbean hair and wigs. So as I said, we've gone to a situation where we've received negative feedback directly from the patients, and then we've put the changes into place, and as I said, we've finished with some really positive press. Thank you.
The hair salon at the Robert Ogden Macmillan Centre is a short walk across the hospital site from the cancer wing, so Julie and Marie visit patients on the wards, the day case units and in the waiting areas. It was recognised that this did not afford patients much privacy for wig fitting, so an unused room in the cancer centre was secured for the support workers to see patients in a private setting. The room was furnished as a hair salon has been in use since July 2012, and money donated to the hair loss support services was used to finance this. Marie and Julie's presence around the cancer wing has helped to raise awareness of the service and ensure clinical staff are confident to refer patients promptly as needed for hair loss support. Marie will tell you a little bit about seeing patients in the cancer wing.
Myself and Julie spend half of our time on the cancer wards and day case areas, seeing patients before and after they have lost their hair. This can be for patients at any point of their cancer journey. We have even fitted a wig for a patient to get married a few weeks before she passed away. The service is so much more than just fitting a wig.
As a team, we were approached by the National Cancer Action Team to be a pilot site for a patient-led initiative called Linda's Great Lengths Workshop. This involved running workshops where people could come with their friends and family to learn about hair loss, wig fitting and hair regrowth. Demonstrations are provided on alternative headwear from volunteers that are trained, and beauticians are on hand to give advice on eyebrow penciling and eyelash enhancing. The group sessions enhanced existing practice by providing a relaxed and informal atmosphere, encouraging peer support. Following the success of the pilots, the workshops have been adopted as a model to be continued going forward. Patients and nursing staff have commented favourably on the support these sessions offer.
We had already recognised that some people might benefit from receiving the hair loss support in a group setting. The approach from the National Cancer Action Team was an ideal opportunity to put these ideas into practice. A workshop enabling the sharing of experience and gaining support from others in a similar situation. The informal atmosphere allows patients and families to ask questions they might not have had the confidence to ask otherwise. This has led to us developing fact sheets of the information so that this information is available when I'm not there.
Thank you, Marie. So far, we have managed to make big improvements to our services, incurring very little cost. Much of the work undertaken has involved members of staff in the team, the involvement of service users, volunteers and the wig suppliers. The Great Lengths Workshop is a cost-effective way of providing support for a greater number of patients and their families with only a few hours of the hair loss support workers' time. During these economically challenging times, we also sought to make the service more financially sustainable without compromising the quality of the service for patients. Alongside the initiatives we've discussed, over the past 2 years we also worked closely with our supplies department and our wig provider to increase the range of wigs on offer under the NHS scheme and within our price range that we limited ourselves to. We also negotiated an improved fitting fee from the providers for each wig fitted by our hair loss support workers. We sourced bandanas, turbans and sleep caps at reasonable prices which we can sell to patients at very competitive rates. The variety of work streams have led to a more equitable, accessible and comprehensive hair loss support service which meets the individual needs of the cancer patients. We're delighted that our hair loss support service has been recognised for the work we have done, and I'm so proud of the Robert Ogden Centre team as a whole, the staff and the volunteers. We're keen to share our good practice and will continue to address inequalities in the service, including provision of wigs for men and for children. Thank you very much.
And what are your hopes for the future of your project?
Hopefully we'll be able to continue the good work with different groups, different areas. Obviously this is one project with the African Caribbean communities, but we'd like to expand on that.
And I'd probably like to educate people in colleges, on the cancer awareness and also making of the wigs and knowing how to fit the wigs. Bringing this in front of people. Yeah.
Making more people
And I
aware.
think-
Yeah, make more people aware. Sorry, Tom.
And I think as well we'd like to continue getting service users involved in the design of our services in the future.